Things I got from I think one of the it's a women's group. Yeah. Women, you know, like you gotta get it out. Would you like to join us?
What? I have been. Thank you.
We're just letting you know. Oh, I like his sign too. Remember America, have a great health.
Very How are you? Good, good.
Every American has the same.
Hi, Rita. Bonnie from Indivisible.
Oh, good.
Our sons are in the, my son Nathan is in
Logan's at Hanford now. He's not.
He is. He's not a Costello. He is. Yeah, you did. Yeah, how's he doing?
Yeah. All the classes were good for him.
Yeah.
So are you
First time I've done this.
I see you guys as a
Yeah, agreed.
So here we are. We're here for the Affordable Care Act.
Oh, I love it.
There's a couple of different groups involved.
No, I think that's part. I think that's part of it. Yeah.
Good. How are you?
There's Rob. He has a GoPro on his head like a dork. My mom, she's hiding behind the sign right there. We were chanting a minute ago.
Good afternoon, everyone.
Okay, here we go.
Good afternoon, everyone. Everybody, if you would clear a path here, you would clear a path so that the street, I'm just telling you. Hi, everybody. If you would just clear a path here, great. So that the street, so we have street. There you go. Hello, everybody. Thank you so much for coming in support of the Affordable Care Act. Congressman Ryan Costello's statement on January 13th regarding his yes vote to provide Congress with the legislative tools necessary to repeal and ultimately replace the Affordable Care Act states that, quote, the way to improve our health care system is by reducing the role of Washington, D.C. bureaucrats and the ACA's mandates on doctors and patients, unquote. Donald Trump's executive order signed on his inauguration day states that, quote, it is the policy of my administration to seek the prompt repeal of the Patient Protection and Affordable Care Act to minimize the regulatory burdens of the act, unquote. Let us not forget that the official name of the ACA is the Patient Protection and Affordable Care Act. Let us not forget, too, that the premise of Republican Party policy is to reduce the role of the federal government and minimize regulations. Some might say to deregulate exclusively for profits and the bottom line. With this in mind, let's take a look at Paul Ryan's Better Way plan, which is being promoted as the Republicans' Obamacare repeal and replacement plan. Number 1, privatize Medicare. Rolling back the $800 billion in savings and the ACA's funding to Medicare. The Affordable Care Act helped to ensure Medicare's solvency. This federal program would no longer act as a single payer. Number 2, establish block grants for Medicaid. The concern is that some states would deprive access to health care to poorer adults, as seen when Republican-controlled states such as Pennsylvania under Governor Corbett refused the ACA Medicaid expansion. Number 3, remove the pre-existing clause and insert a, quote, continuous coverage clause, unquote. There will be a one-time open enrollment, then you must keep the coverage for life, continuously. If there's any interruption in coverage, you'll go back to paying the higher costs for the rest of your life. Number 4, restart high-risk pools. Obamacare eliminated these pools by ensuring everyone, regardless of pre-existing conditions, would be insured. Without that provision, your insurance coverage is prohibitively expensive, forcing you into state-based sick or high-risk plan pools, increasing health-related bankruptcies and increasing concern for the level of care of the sickest of people. Number 5, insurers can charge more based on health status, gender, and age. This would mean higher rates for everyone who has ever been sick, suffers from chronic illness, or has a dependent with medical issues. And lastly, number 5, repeal the mandate. Now, the mandate to have coverage. Now, this is the problem. Americans want the security of health insurance, whether they're a senior, a man or a woman, young or old. We want the provisions of the Affordable Care Act safeguarded. The question is, how will these provisions be funded? Rather than thinking of policymakers as Washington, D.C. bureaucrats, we are here to encourage Representative Ryan Costello to do his job as our elected official and act as our advocate in crafting legislation that will protect patients and provide affordable care. Do your job, Ryan Costello. And so I'd like to introduce you to Laura, who will give her story. Thank you.
Thank you. My name is Laura, and I'm going to talk to you about my family's experience with the Affordable Care Act. My husband and I are self-employed and have been for many years. We have always had to purchase our own health insurance for ourselves and our 3 children. It has always been very expensive. The costs have gone up each year for 15 years, sometimes by a large percentage. Under the Affordable Care Act, our insurance looks largely the same as it did before. The prices went up somewhat the first year and more this year. But anyone who has purchased individual insurance for many years knows that price increases are nothing new, despite what Washington wants us to believe. However, it's the other parts of the Affordable Care Act that have been remarkable for us. One of our children has significant special needs. Because of his autism, he receives some services that are paid for by medical assistants. Every year, the application process for medical assistance has been a time-consuming headache. I fill out a huge packet of information, and it often gets lost by the state. Before the ACA, I've often had to spend several days sitting in waiting rooms just to have his vital services reinstated. This year, for the first time, a large part of the process was simplified through our health insurance marketplace application. Instead of having to fill out a large packet of information, I simply answered a couple questions at the end of my regular online application, and this saved hours for me and for the government. Imagine that. Government made something faster and easier. In addition, we have the peace of mind of knowing that our son's needs will be met in other ways. Knowing that he and we cannot be penalized or denied coverage because he has a pre-existing condition is an invaluable protection for my family. So is the fact that health insurance companies cannot hit us with an annual dollar limit for services. When you have a child with a lifelong medical or behavioral issue, dollar limits can ruin you financially. In addition, families like mine will be protected into the future because the ACA now requires no-cost screening for autism at both 18 and 24 months of age. We've all learned about the importance of early intervention. This can help get children the help they need at the earliest possible ages. Is the ACA perfect? Of course not. But it does more for more people than anything else that has ever existed. And with continual improvements, it can only get better. So please keep the Affordable Care Act intact. Strive to improve it where necessary, but don't take away this essential benefit that my family and so many others depend on. I'm going to turn it over now to Mary, who's going to tell her story.
Hello, everybody. I wanted to thank the women who spoke 2 weeks ago because their courage to speak gave me the courage to speak today. And I wanted to just share my personal story with the Affordable Care Act. I have a pre-existing condition, and as a result of that, I can't work full-time. My husband has been the primary breadwinner in our family, and he's always carried our family's benefits. 4 years ago, 3 days before Christmas, he was unexpectedly laid off from his job, and we were forced with the decision to return a lot of the Christmas presents we had purchased for our children because we knew we were going to have to pay for COBRA to carry my pre-existing condition as well as our children's insurance. My husband is the best person you'll ever meet. He is smart. He is so hardworking. The fact that he couldn't provide for us was devastating to him. He's also in his 50s. Trying to find a job when you're in your 50s is next to impossible. If it weren't for the Affordable Care Act, we would not have insurance. 4 years ago, when he lost his job, I had to forgo one of the medications that I take every evening because it costs over $200 a month. When you have unemployment coming in, you're paying for COBRA, an extra $200 a month is just an absolute impossibility. So, thanks to my friend Chris, who is someone who said to me, you can get insurance through the Affordable Care Act. And I said, but Chris, I Googled it, and it just took me to regular insurance companies. And she said, oh, that's brokers. They have brokers that actually will come up in your search, and so you think you're getting insurance through the Affordable Care Act, but you're just getting, Joe from Aetna who's helping you out, which is not a help at all. So, long story short, I just wanted to say that it's imperative that we keep the Affordable Care Act. It doesn't just benefit people like me who really, really needed it at a time, but it benefits people like my girlfriend whose son is on the autism spectrum as well. It's helped him to receive services where 5 years ago, she would bang her head against the wall just trying to get him the basic services. So I'm asking Ryan Costello to please not just repeal it, not replace it. Oh God, I'm sorry, to fix it. That's all. Fix it, make it better for all of us. Thank you so much.
Thank you.
We stand with Mary. We stand with Mary. We stand with Mary. We stand with Mary.
Good afternoon, Chester County. My name is Antoinette Krause, and I'm the Executive Director of the Pennsylvania Health Access Network. Thank you. We are a state
statewide advocacy organization that makes sure that consumer voice is represented in all forms of government, from local conversations to state and the federal government. And we're here today to say we cannot repeal the ACA. We cannot go backwards. We also help folks enroll in health insurance coverage. We've enrolled over 7,500 individuals in Medicaid, Marketplace, and CHIP over the past 3 years. And one thing, the Democrats, Republicans, they're from urban populations, rural populations, Philadelphia, Pittsburgh, and everywhere in between. And what we see is the look on their face, the relief that comes from knowing they have access to affordable, quality health insurance coverage, and they're no longer one accident or illness away from losing their insurance. I just want to talk real quickly about what's on the line as we encourage our members of Congress to do the right thing. There are 1.1 million Pennsylvanians that rely on the Affordable Care Act to get insurance. There's over 5.5 million individuals in Pennsylvania who have protection because they have a pre-existing condition and they no longer have to worry about their coverage being pulled when they get sick or denied care. 5.5 million Pennsylvanians, let's just talk about that for a minute. That's almost half the population of our entire state is protected from the Affordable Care Act. On Wednesday, the Pennsylvania Health Funders Collaborative released a report that shows what's at stake right here in Congressman Costello's district. There are 40,709 individuals, so we'll say 41,000 folks right here in this congressional district that are getting their health insurance coverage through the Marketplace and through Medicaid expansion. We've seen $75.5 million come to hospitals in this congressional district, and there are 591,000 individuals in this congressional district who benefit from important consumer protections. That's pre-existing conditions, it's no more annual or lifetime limits. And to put that in context, that's 82% of the population of Congressman Costello's district. So we're here today to say, and I love the sign, ACA, build on it, improve it, don't repeal it. That's our message, but we can't go backwards. And if we do, what happens to our economy? What happens to the lives that are on the line? To Mary, to Laura, and the millions of Pennsylvanians that rely on this coverage. So we're standing with you guys. We're really excited. Keep rallying, keep sharing your stories. It's working in DC. If you asked me, I would have thought we would have repealed the Affordable Care Act already, but they're split. They know we can't repeal the Affordable Care Act without a replacement. So we encourage you all to keep rallying, to keep sharing your stories. You can join our campaign. You can text 412-512-9225. You can go to insurepa.org for up-to-date information. And we're here and we're proud to stand with you guys to protect the Affordable Care Act. And so no one knows better about the impact of our local economies than those in the ground, our local legislators. So next I'm going to hand it over to Joshua Maxwell, who is the mayor from Downingtown. I mean, there's Republicans, Democrats, everyone in between rely on the Affordable Care Act.
Hello, everyone. Let's start by giving a big round of applause for these folks who courageously shared their stories with a bunch of strangers. Let's give them a big round of applause. It's stories like that and people like this who are going to get Congressman Costello to change their votes. And thank you guys very much for doing this. And I hope every Saturday we get to hear more and more stories that eventually get Ryan Costello to change his mind. A few weeks ago, we stood here as a group, as a bunch of folks from Chester County, and we called on Ryan Costello to represent all our values here in Chester County. We asked him not to repeal the ACA without a replacement. We asked him not to defund Planned Parenthood. Since then, he's made votes accordingly. He's voted for the repeal of the ACA without a replacement, and he's voted to defund Planned Parenthood. So let me be very clear from the outset, because more men need to say it, and more men need to know it. Planned Parenthood saves lives. The Affordable Care Act saves lives. You cannot represent Chester County values if you're voting to take health care away from thousands of our residents. People trying to bridge the gap from job to job or to get out of a violent domestic violence situation needing to get on their own health care immediately. So let me share my story. Because when I think about values, when I think about the type of person that I want representing me, I think about my mother. My mother raised 4 kids on Jefferson Avenue in Downingtown. I know we have some Downingtown people here who know Jefferson Avenue. A bunch of Downingtown people. And Phil, by the way, Phil Diggs, a borough council member in Downingtown, hold up this sign. Thanks, Phil. So, my mother raised 4 kids in Downingtown, largely by herself. I remember being 14 years old, I was a deacon at my church, and I asked my mother what I could do to help the town. And she said, Josh, we need more domestic violence centers in Chester County. I didn't put 2 and 2 together. I didn't think about it all that much. I was a sophomore here at West Chester University, and my mother filed for a divorce, and I moved back home my junior year. My mother took on a second full-time job, 80 hours a week, Monday through Friday, working second and third shift at the Chester County Hospital to keep a roof over my younger brothers and sisters' heads and making sure they got to stay in the Downingtown School District. My mother is a saint. And for the 7 years that I've been mayor of Downingtown, my entire salary is direct deposited to her to help her pay off her mortgage. So no. It's about my mother. So when I think about the type of values that represent the best of Chester County, I think about my mother. And that story is not unique to Downingtown or not unique to the people standing here in front of me, and I realize that. A year ago, a woman sent me a Facebook message, because that's what you do when you have a young mayor, you send a Facebook message. And she was deeply concerned about her friend. Her friend needed to get out of a domestic violence situation, and she needed 3 things to go right and go right away. She needed a full-time job. She was working part-time. She needed housing immediately. And she needed health insurance for her and her child. She worked for the county government. We were able to get her full-time hours that week. We were able to find her housing that week, the next day. And we were able to get her health insurance that day because of the Affordable Care Act. The Affordable Care Act saves lives. A few weeks ago, we asked Ryan Costello to represent our values, and since then, he's consistently voted against that. Today, we're here to hold him accountable and to let him know that we see his votes. He's voted 93% of the time with Donald Trump, who does not represent our values, and we made that clear on Election Day. He does not represent our values, and we want Ryan Costello to come back home, hear us, and represent us in moving forward. Thank you guys very much.
I'm here just to briefly tell you this one thing. Everyone says they come to rallies and they come to meetings because they want to do something, and they want to hear all the things that's wrong, but what can we do after that? And that's my job. My job is to tell you what you can do next. Well, our little team of 3 did is we created a handout, a 2-page handout of not just a list of facts, because anyone can go online and find a list of facts that you all need to know. But when you hear people like Paul Ryan or other Republicans shout out at you and say things like, Obamacare is a job killer, I want you to be able to say, no, Obamacare is a job creator. So I want you to be able to say things with proudness and with facts. And what this handout is are 9 of the typical statements that they make, and how you can respond without arguing. If you argue, you lose. And so if you just respond confidently with facts, they have a harder time disputing you. So along with saying that Obamacare is a job creator, you say tens of millions of people were able to get health insurance. Because of that, they went to the doctor, they got vaccinations, they were able to get that knee replacement they couldn't afford before. And with that, guess what? You need more doctors, more nurses, more physical therapists, more administrative assistants, more urgent care centers are created. What is that? Job creation. There's no way you can call that a job killer. So there you go.
The jobs they can't ship away.
Right. Exactly. And you can't ship away. So basically, that is just one of the questions I have on here. Not questions, statements. And so what this is